Hi guys, long time no see. So today, my room's a mess, my bed isn't made, there's shopping bags over there. But I don't care, I'm not gonna apologize because... Anyway, so today I'm going to be doing my first round of treatment story. Basically, how I'm gonna do this is every week our treatment team would have a meeting and everyone would anxiously await this because this is when we found out if we got like a pass, if we made stage, if we were getting a tube, just like anything like that. So yeah, the patients, there was a lot of talk about it and it was very anxiety inducing. So our team met. I had my dietitian, my therapist, my psychiatrist, and my medical doctor. And they filled out this sheet that they would give to my parents that had like my goal weight on it, and then they would give me one that didn't have my goal weight on it. And so that's kind of how they like monitored our progress. And so yeah, I'm just gonna be going through all of my sheets from my first treatment stay, which was for 3 months. If you guys want to see my second treatment stay, I can also do this. But yeah, I kept all these sheets in my binder slash folder that they gave me when I was admitted. Is looking at this binder gives me anxiety. Okay, so basically I'm gonna break this down. So we have, I'm just gonna show you first kind of what the front and back look like. So here's the front, and then here's the back, and then everyone basically signs it. So everyone on your treatment team, your parents, and you. On this side we have the problems, and then we have the patient goals, and then we have the objectives slash interventions, and then the staff responsible for that goal, and the target date. I was admitted April 24th, 2017. God, it's so long ago. That was a fucking annoying. Okay, the first thing is eating disorder. So I have anorexia nervosa restricting type, and my patient goals were to boost less for foods I don't like. I think at the beginning, a lot of my boosting was just because like, oh, like that's a vegetable, I don't want to try that, like that's gross. Because if you guys know, I also have emetophobia, which kind of is really complicated with anorexia because it's hard to like separate the two. Okay, and then I have to choose snacks quicker. Okay, so a huge thing at my treatment center is they listed all of the snack options, and I can do another video on like snack options and stuff, but they listed the snack options and people would like calculate like which snack is less and which is more, but they were all like the same amount, but like some of it was like 2 calories less, and everyone like freaked out about that. Not be totally focused on calories. When I first entered treatment, I was still counting calories. I would just write down everything, and I had this like thing on the back of my notebook. It was like a list of like calories and stuff. So I would like go through that, and I would still try to count my calories. Those were all registered dietitian goals, and then the second goal is to be able to eat with my parents again. I am very scared of just eating with anyone in general. I don't know why. Okay, I do know why. That's a lie. I just don't want them to be thinking, oh, she's eating too much. You know, she doesn't have an eating disorder. She's too fat. Okay. So the objectives for my eating disorder were to complete 100% meal plan, increase variety of foods eaten by completing 50% of food items before using supplement, and to participate in meal therapy, weight restores to goal weight range, accept meal plan increases as needed to meet energy needs, complete at least one parent-supported snack this week. So that's where my parents would come and eat snack with me. And then therapists will meet Kate to discuss ED history. Therapists will work with Kate on countering her negative self-thoughts, and Kate will complete therapeutic homework assignments of what it means to be in control. A lot of what eating disorders have to do with is not food, it's actually control, and I think that's not all of it. I think some people talk about that too much, but yeah, that is definitely a big part. At least it was for me. We have psychiatric disorders in the next column. Major depressive disorder, reoccurrent, moderate, and obsessive compulsive disorder. So the patient goals are to catch up on life, and the objectives are to, therapists will use DBT skills to help Kate with self-harm and anxiety. Therapists will have Kate complete chain analysis when she feels highly anxious or has self-harm urges. I had been using DBT, right now I have been using DBT for almost 3 years. So at this point, I had already learned every DBT skill there was. I already knew them. I had even brought in my DBT handbook, which is this really, I'm looking at it right now. It's this really thick, It's this really thick book that just has every DBT skill in it, and it's the adolescent one. And I had group therapy and individual session, so every week. So I already knew all the skills by this time, so they kind of wanted me to continue using that through my recovery, even though it's not used to treat anorexia, but it could be helpful with self-harm and my depression. Family therapy. So lack of education for family regarding causes and treatment of eating disorders, parental lack of awareness regarding feeding child or providing effective interventions for eating disorder behaviors. So this was on most people's sheets, and basically you should not, a parent should not be trained to be constantly monitoring what their child is eating, especially at my age. I was 13 at the time. My mom, she shouldn't have to know that when I do this, that's an eating disorder behavior. So parents don't, if their kid hadn't been in treatment before, they wouldn't know that, so they wouldn't catch on to it as quickly. So it's not an insult to the parent, it's just they just don't know. The patient goals are to update family on clinical concerns and have meals and snacks with family. Kate's treatment team will meet with her parents on May 3rd for initial family session and update. Kate's parents will be educated on how to help monitor meals and snacks, so recognize behaviors and things. And Kate's parents will discuss going on snack pass in next week. Okay. So it's just a pass for snack. Pretty self-explanatory. Okay, and then these are the teacher goals. So I just did to keep up with schoolwork and recovery at the same time. Kate will complete schoolwork during tutoring time. So basically the problems were inability to attend classes or work due to treatment schedule, and poor concentration interfering with ability to complete school, work, or voluntary activities. This was basically with everyone. Obviously, we were going to treatment every day, and if you had tutoring, you couldn't go to school. I haven't said anything that triggering, right? Okay, trigger warning. I will put it in the title. I will be mentioning diagnoses and my state of health, if that's triggering anyone. I will also be mentioning feeding tubes and stuff like that. So for medical, we have malnutrition severe, so we need to improve nutritional status, and then potential for fluid and electrolyte imbalance. So stabilize normal fluid and electrolyte balance, weight restoration, vitamin and mineral supplement, monitor weekly labs, encourage fluid intake. At my treatment center, I had labs 2 times a week. So I think it was Monday and Thursday or something. But yeah, most people had it at least once a week. Potential for cardiovascular instability, restore normal cardiac function, monitor daily vital signs, encourage fluid intake, tachycardia unspecified. This was before I was diagnosed with postural orthostatic tachycardia syndrome, so we did not know exactly what I had. So monitor daily vital signs, encourage fluid intake, have decreased Seroquel, I think, and obtain EKG to monitor. We'll recheck EKG on May 4th to reevaluate. Okay, and then it has current medications, Effexor, Seroquel, multivitamin, discharge planning. Kate will need a referral for an outpatient dietitian prior to discharge. I did not have one at the time. I had a therapist and psychiatrist, but not a dietitian. Procedures and consults, EKG obtained March 1st, due to tachycardia and concern for prolonged QTC interval. On 5/1/17, CMP showed CR low. Oh my, what the fuck? Okay, this is just like nutrition things. Okay, treatment summary. I might skip through some of these because a lot of the goals overlap, but I will do the treatment summary. So, treatment summary for May 2nd, 2017. Kate completed registered dietitian supported snack exposure as planned with her mom on April 28th. Kate requires use of supplement for meal plan completion this week. Kate will take a snack pass with parents this week to begin eating with parental support. Kate has reported her main motivations toward recovery at this time are her parents, with some desire to get better to not have such distressing self-thoughts. Kate has reported that completing her meal plan has left her with feelings of guilt and negative body image. Kate has reported her self-harm urges have not increased since admission to McCallum Place, but they persist at her baseline level. Kate applied to stage 2, but due to medical instability, this was denied. She will have some snack passes if possible, however. Kate has abnormal vital signs, including significant orthostasis and tachycardia to the 160s with some dizziness. EKG on May 1st showed prolonged QTC at 4:51, and then more nutrition thing, 5/9. So May 9th. Let me know below if you like this. I don't know. I just have this idea. I thought it'd be interesting for you guys to see that treatment is never a one, like, just like you're done. It's like up and down, like all the time. Like, I was doing so well, and then I started getting refusals, and I was doing so well, then refusals, then a tube, then normal, then not good. And it was just like that. It's the same for the second time, and that's always going to be the case. You are never always, no perfect recovery is what I'm trying to say. For my patient goals, I had to boost less, and I'll try to only boost 4 times this week to be more confident and be able to eat with my parents again. So yeah, we have complete at least 2 fear food exposures this week. Kate will write down negative thoughts prior to eating challenging meals and snacks and discuss counters in therapy. Kate will continue to discuss what it means to be popular in therapy, and therapists will work with Kate on countering her negative self-thoughts. We decreased my Seroquel because it was affecting my QTC interval. Kate has applied for stage 2 again and was approved. Kate successfully completed her first snack passes with parents over the weekend and will take her first meal pass with parental support this week. Kate has reported a strong value on being popular in school and will begin to discuss that more in depth in therapy. Kate has been participating in group therapy. She continues to struggle with low mood, decreased energy. I have no idea what that word is. Okay, guys, you can figure this out in the comments. ANHEDONIA. No idea. And with urges related to restriction and to self-harm, but has not acted on these urges. She is meeting weekly weight gain goals this week. She continues to require use of supplement for meal plan completion 5 to 6 days this week. Okay, so this is from May 16th, and then for objectives, we have Kate will share homework assignment of image of my ED in therapy. If you guys want a video of like seeing all of the like assignments I did for in McCallum, or just like all of the worksheets I did, like I have hella amount of worksheets, so I can probably put that into like 2 videos. So complete assignment on challenging myths and fears around fat and protein. Okay, and then we stopped Seroquel and started Zyprexa, and then it has all of my procedures. So we have the labs with glucose 121 and then some other milligram thingies. Okay, EKG with sinus tachycardia, heart rate 101, and QTC interval 439. EKG with sinus tachycardia, QTC 441. EKG with sinus tachycardia, but QTC less than 440. So that's improved from the previous one. KG obtained due to tachycardia and concern for prolonged QT. Kate has continued to complete meal and snack passes with her parents to practice meals outside McCowan Place. She reported increased anxiety and shame following first meal pass with parents due to fear to cheese and fat. I have no idea what that meal pass was. I think if I read in my diary, I would be able to find it, but I don't remember. Registered dietitian has been helping Kate fact check her fears and myths around protein and fat. Kate has become more insightful into her ED and how it relates to her OCD and anxiety. If you guys want a video on my eating disorder myths, I can totally do that. It'd probably be triggering, but I think it's interesting because a lot of people, when you're in recovery, you're like, what the hell? That makes no fucking sense. And it's kind of, makes me feel proud to look back and see that I've come so far. Kate continues to be transparent with treatment team regarding self-harm and self-injury urges. Suicidal ideation urges. That's what it stands for. Kate continues to report an importance of being popular and how it is related to her ED. She has been accepting of the need for medication changes and denies any significant worsening of depressive symptoms with the decrease and I don't know what that word is. Okay, comments, guys. CESSATION of Seroquel XR. She denies any symptoms associated with her tachycardia and is meeting goals for fluid intake. Kate continues to report distress towards food. She's fearful and will make her sick. She continues to require use of supplement for meal plan completion. Okay. Now, the reason I was denying any symptoms of tachycardia, of my POTS, which we didn't know yet, is because I had had those symptoms for almost a year and a half now. So I was like, no, that's normal. Everyone has those symptoms. I was like, that's just what I thought, because I didn't know any different, because by this time I'd forgotten what it felt like to not constantly be dizzy when I stand up and constantly be tired and not have enough energy. So yeah, that's why I reported no symptoms. Yeah, I mean, I guess. And then when I went to the cardiologist, she's like, well, do you feel this and this and this? I'm like, well, yeah, but that's normal, right? It's not normal, guys. Go to the doctor. Here is a monumental step, guys. My patient goal is to try chicken. Kate will continue to discuss her fear of getting sick and how it relates to her ED. And it doesn't say this, but yeah, I tried chicken. Medication changes: increased Zyprexa, decreased Effexor, current medications, Effexor, and Zyprexa multivitamin. Kate has continued challenging ED thoughts to complete meal passes with parental support this week. Kate agreed to challenging fear of meat/protein with 2 exposures, chicken, this week during programming. Registered dietitian is challenging Kate to increase variety of snack choices this week. Per other client report, Kate and peers were calculating their BMI and rating each other's level of attractiveness on the unit this week. It was also found that Kate has been keeping a log of calorie counts in her journal. When processing the situation, Kate reported calculating her BMI prior to admit for reassurance and reported a lack of motivation for recovery. Kate has continued to appear removed from the community and wanting to isolate during downtime. Vital signs have continued to be normal, including tachycardia up to 144 BPM and orthostatic pulse changes. Guys, I'm not proud of my actions during treatment. I'm proud of eating, but that's basically it. One thing that is extremely, unfortunately popular in the ED treatment is talking about body image and how I look and how sick that person was and how much weight that person has gained. That just is inevitable kind of to happen. It's really hard to prevent it. Not proud of it at all, but I did it and can't change that now. May 30th. Boost less, only 3 times this week. Try something new, be more confident, able to eat with my parents again. Increase Zyprexa, decreased Effexor, started fluoxetine. Oh, look at that. More tachycardia. Kate has continued to struggle with feeling isolated from the other patients in treatment and has stated that she does not understand why other people care about her, reports not feeling deserving of this. Kate did attend a meal outing and confront her fear foods of chicken and lemonade. She will continue challenging her fear of meat this week with 3 exposures during programming. She is taking 2 passes per week with parents to practice eating with parental support. She continues to endorse chronic self-injury urges, though she does know how to avoid acting on them, per her. She continues to require support to build motivation for recovery. She does have ongoing tachycardia up to 157 and orthostatic pulse changes. She was seen by Dr. Rudnick, who recommended ongoing decreases of Effexor to address this. Kate has begun to explore how her OCD is related to her ED therapy. EKG on 5/30/17, 103 to 17 BPM, sinus tachycardia, QTC 437 to 449. June 6th. Increased Zyprexa, decreased Effexor, current medications, Effexor, Prozac, Zyprexa, multivitamin. EKG on the 1st, we have heart rate 114, 117, QTC 456, 459, and then we have the same QTC on the 6th with tachycardia 104 to 109. Now, if you guys are wondering, like, why is it sometimes like 120 and why is it sometimes like 103? So it really depends on how long I'm laying down on the table before they actually do the EKG, or like how long it takes them to like put the stickers on me. Because the more I lay down, the more to my base level my heart rate is gonna be, which is around like 110 laying down. So yeah, that's just why it's like sometimes extremely different. Treatment summary. Kate stepped down to PHP on 6/3. She has ongoing tachycardia up to 134 in the last week and a slight increase in QTC. Dr. Rudnick was consulted and agreed with continued weekly EKG monitoring and continued downaturation of Effexor. She has ongoing significant depressive state with chronic urges for self-injurious behaviors and thoughts of death, but no active suicidal ideation. She has been utilizing coping skills appropriately to avoid acting on self-injurious behaviors. She is tolerating medication changes but denies any significant benefit at this time. Kate has continued to work on her OCD thoughts and how they relate to her ED. She is adhering to meal plan during and outside of treatment. Kate has continued to inclusion of meat and components into meal plan this week. She is struggling with increased hunger since recent meal plan decreases. Kate has begun reporting feeling like her ED and being vegan were part of her identity. She continues to report low motivation. Guys, we only have 2 left. My patient goals are to adhere to meal plan and try to eat at least half of lunch today. Okay, one of my goals is just I have a fear of throwing up. That's not a goal. Increased Zyprexa. Decreased Effexor. Medications, Effexor, Prozac, Zyprexa, multivitamin. More tachycardia. What else is new? Last week, Kate reported struggling with increased hunger following meals as meal plan decreases continued. Kate has reported a recent increase in anxiety over the past week, especially at mealtimes. On 6/9, Kate began refusing portions of 1 to 3 meals per day during and outside of treatment, reportedly due to anxiety. Today she reported refusing to complete lunch due to stomach pain. I don't remember that. I think that was a lie. I don't think that actually happened, but that's what I said. Due to her increase in food refusals, an NG tube will be placed on 6/13. Kate continues to take several meal passes with her parents per week and is incorporating meat and dairy products on a daily basis. Kate has continued to report that her anxiety occurs at both home and McCowan Place. Kate's parents have expressed concern toward her legs turning red when she stands. Kate continues to report isolating from most of her friends and that she doesn't feel treatment is that bad. Kate was stepped down to stage 1 due to her recent meal refusals. Basically, all this anxiety started one night when I had a panic attack because my boyfriend at the time told me about his suicide note. This really triggered it. I was eating snack at the time. I refused to eat any more of it. I felt extremely nauseous. I told my dad about it, but from there, I was just like, no, not doing this anymore. My patient goals are, I'm not sure. Adhere to meal plan. Attempt to complete meal plan orally. Stopped Effexor. Increased Prozac. Prozac, Zyprexa, multivitamin. NG tube was placed on 6/14 due to continued inability to complete meal plan orally. Kate has heightened anxiety when getting NG tube placed out of fear of throwing up. Kate has been able to complete meal plan with use of supplement via NG tube and orally. Kate reports decreased hunger cues over the past week due to increased anxiety. Kate has continued to struggle with fear of throwing up while eating. Kate has identified that meat and vegetables give her the most anxiety out of fear of throwing up. Kate went on 2 passes with her parents over the weekend to continue to have meal practice with parental support. She has not used NG tube in 3 days. Vital signs have been improving with normalization of QTC and discontinuation of Effexor XR. Alright, children. That is all I have. Now, it might be somewhere else. Alright, guys. I did not find any more. Alright, guys. That is it. I did not find any more. I think I discharged like halfway through July. I know. So cute. Okay, guys, everyone say hi to George. He loves me more. Okay, guys, that is all for today's video. Leave my Instagram below. Comment, like, subscribe. Like for George. Alright, guys, bye.